So what additional measures did you take?
Well, I was immediately concerned for little Molly's health, and I contacted my friend, who's a pediatric cardiologist, and referred Molly to her. I'm sure she would talk to you if you wanted more information.
Well, thanks for talking with us.
This is my pleasure.
So we're here at the hospital with Dr. Wellington. She was the first pediatric cardiologist that correctly diagnosed little Molly. How were you able to do this?
Well, the primary means of diagnosis for pulmonary hypertension, which is what little Molly has, sadly, is a heart catheterization. And what that really means is we take a thin, flexible tube and thread it through a vein into her right ventricle and the pulmonary artery, and that lets us determine the pressure. We found a higher than normal pressure in little Molly's artery, which indicates a pulmonary hypertension. Well, as I said, secondary pulmonary hypertension can be caused by a variety of factors, but idiopathic pulmonary hypertension is a little different. We think it may be genetic, but it's still a bit mysterious. For some reason, there is an overgrowth of cells or a buildup of scar tissue or just some restriction in her pulmonary vasculature. Oh, there are a number of complications and very, very severe consequences. The patient can cough up blood. Blood can be forced to the lungs. It can cause arrhythmias, right heart failure. The right side of the heart actually gives out from pushing too hard against this resistance. And serious blood clots that can cause death of tissue. The most prominent treatment are vasodilators, which is what we put Molly on. You can also use calcium channel blockers, which just regulate the heartbeat. In Molly's case, we actually had to surgically implant a pump that gives her a continuous intravenous dose of prostacyclin, which again is a vasodilator, and what that will do, it will lessen the resistance in her vasculature and let the blood flow more freely.
Well, good to hear from you. Thanks for taking time out of your day for talking with us.
Oh, it was no problem.
And this has been another rendition of Mystery Diagnosis, here on News You Can Use. I'm your host, Brock Phillips, and I think we speak for everyone by saying good luck, little Molly Parker. We leave you with a few clips from her practice ballet. Good night, or good morning.